Again, just to talk a little bit, Nancy talked about this as well, about it's an older population participating in these groups, but you can see we actually have a nice age range, 25 to 73 with an average age of 50. Predominantly female, predominantly Caucasian. In terms of education, 15 years, so high school graduates plus some college. One of the things that we find very interesting is that we have some folks who basically lower income, lower SES, and over half of our study subjects report annual incomes of under $20,000 per year. The majority are single, only a third are currently employed, and most are living independently in their own home or apartment. Now, in terms of their mental health characteristics, almost everyone in our study has said, yes, that they have seen a professional about a mental health problem. One of the things I didn't put on this slide, however, was that not everyone has been formally diagnosed. Only about 85% have actually gone and actually have a diagnosis. So what you see is a self-report here. The primary diagnosis reported most often is depression, followed by bipolar disorder and anxiety disorder. On average, people have an illness length of 24 years, so they've been dealing with their symptoms for a very long time. Slightly over half have been hospitalized. We have about a third who report a co-occurring physical disorder, so they also have some physical disabilities that limit their everyday activities, and 10% report a problem with drugs or alcohol. One of the things that we asked them in that initial interview was, well, how did you find out about RI? How do we have to get the word out to you? And we have a whole list, so yes, I know those percentages exceed 100, but most of the folks tell us that, a friend or a family member told me about RI, and so I thought I would try it out. We're also very happy to see that 34% said no, my doctor mentioned it, or another mental health professional thought this might be something that was useful to me. I also think it's very interesting that people are hearing about it through other advocacy organizations in addition to the RI website. We also asked people at time one, did you go for a specific reason, or did you just kind of go to drop in? And you can see that the majority report, yes, I went to this meeting for help with a specific problem. Most often it's for help coping with depression or anxiety. So at time one, it's very good that we see that they attended 4 meetings, even though a few attended more than 5, because often by the time that we got their consent documents back and actually were able to speak with them, they've been going for quite some time, but on average they've gone to 4 meetings. It's also very interesting, I find it very interesting, that we have 36%, even at that initial interview, who said, I like this so much I'm going to 2 or more groups, and not just going to the same group. Groups average about 11 members. And at time one, we did actually have 5 people who said, no, I'm not going anymore, but I still want to be in your study, still want to tell you a little bit about my experiences with RI. And they said, I stopped going for reasons that weren't related to the program at all. I went because I had schedule conflicts. We actually had a few people who, when they first enrolled, were unemployed, so they got a job and said, my job conflicts now, and I'm not ready to go on to a different group. I like the group I started with. They had transportation problems or health problems that prevented them from going. At time 2, we have, again, the overwhelming majority still going to RI. On average, in the 3 months since their first interview, they were going to meetings about once a week. 40% going to 2 or more different RI groups, and you can see at time 2, 3 months later, we have 6% of our sample saying, yes, I'm going both to in-person meetings and actually going to phone meetings as well. So Nancy talked a little bit about that, about other ways that people can participate in RI. We had an additional 10 people who dropped out who said, I'm not going to RI anymore. Most of these folks said that, yes, it was the same thing that we heard at time 1. It's transportation problems. It's health-related problems that are keeping me from going. But we did have what I like to refer to as our 3 dissatisfied customers who said, I'm having some issues with the program itself. I find it boring, or I'm not getting enough time to talk. And when we probed a little bit further, we found that actually these were 3 individuals who were looking for more mutual self-help groups where they could really discuss their problems. And as you've already heard, that's not what this is about. This is a training system, so it doesn't really surprise us that they decided they weren't going to go anymore. It just wasn't a good fit for them. Then in terms of knowledge, we developed a 17-item multiple choice assessment because, again, like I said, we wanted to know, well, what are you actually learning, and are you going to be able to use this, and will we see some relationships to outcomes? So at both time 1 and time 2, on average, people had 13 out of the 17 items correct. And at time 2, what we found, and this is of course not rocket science, not surprising, that the people who were still participating had significantly greater knowledge than the people who were no longer going to meetings. And then we also asked people to give us an example. We asked this in every interview because we want, just as Phyllis described for you, because we want to see, are they actually practicing that? Is something sinking in? Can they tell us what to do? At time one, we're actually pretty impressed that 36% of the people, just after a few meetings, were able to give all 4 steps and to do it correctly. And then at time 2, that went up almost significant to that 41%. So in terms of our analyses so far, our preliminary analyses, we've done a series of paired t-tests, and we're finding some very nice results. From time 1 to time 2, we find a decrease in depressive symptoms. People reporting, our subjects report decreased anxiety, decreased symptom domination, and that specifically is, my symptoms don't control my life, I control my life. Better feelings of empowerment and self-esteem and coping mastery, increased feelings of hope and recovery, decreased self-stigma, and greater social support. Now, we don't have that many people who dropped out of the study, and I don't see Robert Gibbs in the room. So, in terms of looking at this statistically, there weren't any significant differences, but again, we didn't have that many people who say, I'm not going to RI anymore. The one exception that I think is very interesting is that when we talked about stigma, the people who were still going to RI were less likely to say that they were internalizing feelings of stigma that were affecting their self-esteem versus people who were no longer going. So that's always very nice to see. Okay, so just very quickly, what do we know so far? Again, no surprise, we know that it appears that the traditional or the typical RI member is someone who is middle-aged and closer. I get to 50, I have to find a new word for that. But 50 years old, Caucasian women who've been coping with mental health symptoms for many years. And at 3 years post-enrollment, we still see people still going, so it's not something people are going to once or twice and say, I don't want to do this anymore. What I find very nice and that we hope we'll find as we look at the time 3 and time 4 data is that our preliminary results say that even some exposure to this training system is helping people manage their symptoms and cope with everyday problems. And I think that's most evident when we look at the changes in hope and personal recovery. One of the things that's not on the slide is that our subjects come in consistently with low levels of hope and personal recovery. They really think, I've been struggling with this for so long, I don't think there's any way I can get over this. So the fact that in 3 months we already see some significant changes in, I am not my mental illness, I can control this, my symptoms are not going to control me, says a lot to the power of this program. And then again, finally, we hope with our additional assessment points, we'll be able to make some nice connections between knowledge and using the example and our outcomes. I want to end my part today by talking a little bit about some of the comments or sharing some of the comments from the interviews. We asked everyone at each interview, can you tell me some ways in which RI has helped you? And some of these comments you've already heard before, but I selected these because I thought they really spoke highly to not only what we see in the data, but to what we know about the program. Particularly the last one, that RI is life-saving. But some other ones there as well. Before RI, I would worry all day and not get anything done. Now I use the tools, I can calm down, I can get my work done. Other people talking about, helps me cope with the little big things in life, that they really get this here. I don't feel as isolated anymore. So I'm going to end with that, but I think we have a few minutes for questions for the entire group. I'm going to leave this up here because I think it's a nice demonstration of the program.